Hi, I'm Andrew Crowe. I'm one of the physiotherapists in the emergency department. Welcome to Video Physio. You're watching this video because you need crutches, whether you've had a sprain or a fracture or many of the other reasons you need these crutches. Now, you've seen a lot of kids and they're hurtling around and they look pretty easy. Crutches for the first couple of days can actually be quite hard. So the most important thing you can do is take your time. This video is going to show you some of the do's and don'ts about crutches. The first thing that we need to do with your crutches is actually measure it so make sure that it fits you. When you place the crutch under the armpit, there should be a 2 to 3 finger gap from the crutch to your armpit. This is so that if the crutch is right up under your armpit, it will compress your blood vessels and nerves, creating a lot of pain. So 2 to 3 fingers. The next part of the measuring up the crutch is actually when you look down at your wrist. With your wrist, the handle should be around the same level as your watch band or the crease in your wrist. Now, the most other important thing to do with crutches when measuring it up is a lot of people will let it flap around. The crutches should be pretty firm against the chest and not straight up and down, but on a slight angle. So firm against the chest. Now I'd like to introduce to you our twin brothers, Jason and Wally. Wally, on my left hand side, is going to show you the wrong way how to use the crutches. And on my right hand side, I have Jason, who will show you the right way how to use the crutches. Okay, as I said, if you have the crutches too high, as you're walking along, you'll probably find you'll get pain underneath your arms. You may also find you get a little bit of a tingling in your hands. If the crutches are too low, or you don't have them firmly against the chest, you'll find that they'll often flap around a little bit and you'll be a lot more unstable. You'll be given instructions whether you're allowed to be partial weight bearing or non-weight bearing. Non-weight bearing means you're not allowed to put any weight on that foot. This is the case when you're wearing a plaster, or if your doctor or physio says you're not allowed to put any weight on it, or if you're in a lot of pain. It's generally easier to either have your leg directly out in front of you, or you can have it bent up behind you as you're walking. It's important when walking with a plaster not to put the weight through the plaster. This means that the plaster can actually crack really quite easily. If the plaster is cracked, it means that there's not much support for the actual joint. If you are allowed to partially weight bear, it means you're allowed to take some weight through your foot, but not all your weight. Use your normal heel-toe action to get the normal gait pattern going. Make sure you don't take too much weight through it if it is painful. It's very important when we go to stand up that we use the correct technique. Put both crutches in the one hand. Use your other hand on the edge of the chair. Lean forward and stand up. Careful not to put any weight on the foot. Then you grab your crutch in both hands and slide it up under the armpit. Be careful not to get it caught on your jumper. And then you're ready to walk. When going to sit down, it's important to get nice and close to the chair. Do small little turns with the crutches and then feel for your leg on the back of the chair. Place both crutches in the one arm and then feel for the chair in the other and lower yourself down. Now, it's very important, don't put both crutches under your arm as you're trying to get up, because it is very easy to lose your balance. Also, it's very important that when you go to sit down, especially on a moving chair, that you really do feel for that chair. When doing stairs, it's important to remember the saying, good leg up to heaven, bad leg down to hell. Get your crutches in a nice sturdy position, and good leg up to heaven means take your good leg up first. So put your crutches down, good leg up first, and then bring up the crutches behind you. Good leg up first, crutches behind you. When going down the stairs, the saying is bad leg down to hell. So hold the good leg where it is, crutches down first, your bad leg out in front, and then your good leg. Crutches, then good leg. Crutches, then good leg. If you try and do it in the wrong way and take your crutches up first, you'll find it extremely difficult. When coming down the stairs, get your order right again. Don't take your good leg down first. When turning, it's very important just to do small little turns. So move the crutches and then your foot. Crutches, then your foot. Crutches, then your foot. When you're turning, don't do big turns because you can lose your balance very easily.
Hey Wally, over here.
Be careful of crowded places and people bumping into you. Probably the most important thing to remember is make sure you take your time and not rush, especially in the first couple of days. Crutches are a very safe way to do it as long as you do take your time and keep them firmly against your chest. Thank you for watching this video on the crutches. Also, you'll be given a handout on the crutches. Make sure you give it a good read. If you do have any questions, contact the physiotherapy department. And please, don't be a wally with crutches.